Few things are more intellectually insulting than hypocrisy. This administration has been deceiving the public about the true nature of their healthcare plan, but let's first look at how Mr. Obama defines a specific kind of healthcare plan.
I want to make a distinction between a universal plan versus a single-payer plan, because those are two different things. A single-payer plan would be a plan like Medicare for All, or the kind of plan that they have in Canada, where basically government is the only person, is the only entity that pays for all health care. Everybody has a government paid-for plan, even though depending on which country, the doctors are still private or the hospitals might still be private. In some countries, the doctors work for the government and the hospitals are owned by the government, but the point is that government pays for everything, like Medicare for All. That is a single-payer plan.
Okay, so are we all clear on that? A single-payer plan is one in which the government pays for everything. Another way to express that is government-controlled health care. That is not political spin. That is parroting the President of the United States.
I have not said that I was a single-payer supporter because, frankly, we historically have had an employer-based system in this country with private insurers, and for us to transition to a system like that, I believe, would be too disruptive.
The challenge is, how do we get the federal government to take care of its business? I happen to be a proponent of a single-payer universal health care plan.
Wait, the President said he doesn't support a single-payer system because it would be too disruptive to the existing employer-based plans. Yet when giving his honest opinion as a politician a few years back, he said he supports a single-payer system. Mr. President, what are we to believe? The President goes on the offensive, ripping everyone who says his healthcare plan has an ulterior motive lurking beneath the surface.
Let me also address an illegitimate concern that's being put forward by those who are claiming that a public option is somehow a Trojan horse for a single-payer system.
Mr. President, you are angry that people are saying that your healthcare plan is a Trojan horse for a single-payer system, yet your own healthcare architect laughs at the idea that it is anything except an overt and guaranteed glide path to single-payer. Behold Jacob Hacker, the Yale PhD who pitched his healthcare plan to all three Democratic presidential candidates.
Someone once said to me, this is a Trojan horse for a single payer. And I said, well, it's not a Trojan horse, right? It's just right there. I'm telling you, we're going to get there. Over time, slowly, but we'll move away from reliance on employment-based health insurance, as we should, but we'll do it in a way that we're not going to frighten people into thinking they're going to lose their private insurance. We're going to give them a choice of public and private insurance when they're in the pool, and we're going to let them keep their private employment-based insurance if their employer continues to provide it.
We are staring at a complete contradiction. So who are we to believe? A politician selling a controversial healthcare bill in front of the national media and a skeptical public? Or the plan's architect speaking at a private function hosted by an ultra-liberal grassroots organization that strongly favors a single-payer system? Mr. President, you either think we're stupid, not paying attention, or both. Your administration's strategy is to mask the fact that employer-based health insurance will vanish, but your team recognizes the reality that this will frighten people. We are not stupid, we are paying attention, and we are calling you out. Okay, if there was any doubt or debate as to whether this plan would eliminate employer-based health insurance, we give you Mr. Obama in his own words.
But I don't think we're going to be able to eliminate employer coverage immediately. There's going to be potentially some transition process. I can envision a decade out, or 15 years out, or 20 years out.
I think if we get a good public option, it could lead to single payer, and that's the best way to reach single payer.
And next to me was a guy from the insurance company who who then argued against the public health insurance option, saying it wouldn't let private insurance compete, that a public option will put the private insurance industry out of business and leave single payer. My single payer friends, he was right. The man was right.
While I think the insurance industry will be very opposed in total, I do think that we shouldn't forget that there's going to be a divide, as there was in the early 90s, between large and small insurers over the best course forward. This would eliminate, I think, the small group market insurance industry, right? It's premised on doing so.
Mr. President, how can eliminating an industry that employs hundreds of thousands for the sake of creating a government health insurance monopoly possibly be a good thing for taxpayers? Just admit that you are jamming an insidious socialist program down the throats of an underinformed public. The breathtaking dishonesty being displayed here is historic and can't be tolerated. Come November, the lemmings who back this bill will be justly removed from office.